At ELCC, we specifically pulled out the outcomes of the non-small cell lung cancer patients who harbored a TRK fusion in their cancers. And there were 11 patients that were part of the Larotrectinib series. And we found that there was a high response rate to therapy. So it was a 71% ORR, considering that the denominator isn't large. And we saw disease reduction in all patients that had therapy, deep responses to treatment, one with a complete response to Larotrectinib. And then in terms of durability, the median duration of response was actually not reached yet. And most patients that received Larotrectinib for their TRK fusion positive lung cancers remained on therapy. The patient that had been on for longest was already pushing 2.5 years. The last thing we featured was the intracranial activity of Larotrectinib, recognizing that there were 3 out of the 11 patients that had brain metastases on this trial. And this has been a question that's come up for the TRK field in general, whether or not these drugs have substantial activity in the CNS. And what we saw was that patients had global overall disease control, meaning that patients had disease regression both extracranially and intracranially.